morning. I am Dr. Munmun Ghosh, Assistant Professor of Bashundhara Ad-din Medical College. Today I mainly discuss the biosynthesis of thyroid hormone. First I told thyroid gland. Thyroid gland is one of the largest endocrine gland of the body, and histologically there are two types of cell present in the thyroid gland. Number one is follicular cell and number two is parafollicular cell, and follicular cell secrete T3 and T4, that is triiodothyronine, and T4 is thyroxine, and parafollicular cell secrete calcitonin. Calcitonin mainly decrease the blood calcium level. This figure show the histological structures of the thyroid gland. In histologically, mainly thyroid gland is composed of follicle, and follicle contain the jelly-like substance, that is colloid. This figure show the inactive stage of thyroid gland, and this figure show the active stage of the thyroid gland. And histologically, I previously told, histologically thyroid gland is composed of follicle. This is follicle, this is follicle, and follicle contain the substance, that is colloid. Colloid is present in this site, and colloid is present in this site. Now I told the difference in active stage and inactive stage of thyroid gland histologically. Histologically, inactive stage size of the follicle is large, but active stage of the thyroid gland histologically size of the follicle is small. Then number two, colloid present within the follicle. Colloid present within the follicle, amount of colloid is large, huge amount of colloid present in the inactive stage of the thyroid gland. But in active stage, colloid present within the follicle is small amount. Within the follicle is small amount colloid present in the active stage of the thyroid gland. Then number three, this follicle, lining epithelium of the follicle in inactive stage of the thyroid gland, it is flattened epithelial cell. But in active stage, lining epithelium of the follicle is either cuboidal or columnar. And this is reabsorption lacunae. This reabsorption lacunae is present in the active stage of the thyroid gland, but reabsorption lacunae is absent in the inactive stage of the thyroid gland. So now I further told the difference between the histologically difference between the active and inactive stage of the thyroid gland. Size of the follicle in inactive stage is large, and this is small. Amount of colloid is large in inactive stage, amount of colloid is small. Reabsorption lacunae is absent in the inactive stage, and reabsorption lacunae is present in the active stage. And then for lining epithelium of the follicle in inactive stage is flattened epithelium, and the lining epithelium of the follicle in active stage either columnar or cuboidal. Now I told this follicular cell secrete T3 and T4. Now I told the difference between the T3 and T4. Thyroid follicular cell of the thyroid gland secrete 93% of the T4, that is thyroxine, and follicular cell of the thyroid gland secrete only 7% of the T3 from the follicular cell of the thyroid gland. Then number 2 is secretion from the T3 from the thyroid gland is less, 7%, but physiologically active is T3. T3 is physiologically active, T4 is not physiologically active, because all T4 is ultimately converted into the T3, then they perform their metabolic action or mechanism of action of thyroid hormone. So physiologically active hormone, thyroid hormone is T3. Then number 3, after secretion of thyroid hormone from the thyroid gland, all of the thyroid hormone is bind with the plasma protein, but binding affinity of the with the plasma protein T4 is more than the T3. Binding affinity is more in T4 than the T3. For this region, plasma half-life of the T4 is more and plasma half-life of the T3 is less. This is overall difference of the T3 and T4. Further I repeat, that is T4 secreted from the thyroid gland is 93% and T3 is 7%, but T3 is physiologically active. Why T4 is not physiologically active? Because all T4 first converted into the T3 and after they perform their function. And after secretion from the thyroid hormone, all hormone bind with the plasma protein, either albumin or globulin, but binding affinity of the T4 with the plasma protein is more. For this reason, plasma half-life of the T4 is more and plasma half-life of the, due to less affinity to bind with plasma protein, plasma half-life of the T3 is less. Previously I told that thyroid gland contain follicle and within the follicle there is presence of colloid and major component of the colloid is thyroglobulin and thyroglobulin mainly composed of 17 tyrosine amino acid and these thyroglobulin are present in the colloid and they mainly release from this follicular cell, because follicular cell of the thyroid gland there is presence of endoplasmic reticulum and Golgi apparatus. This endoplasmic and reticulum and Golgi apparatus mainly secrete thyroglobulin precursor and ultimately thyroglobulin precursor there is release of thyroglobulin into the colloid and colloid for this region colloid of the follicle contain thyroglobulin and major constituent of the thyroglobulin is 17 tyrosine amino acid. Thyroglobulin is composed of 17 tyrosine amino acid. Now I told the mainly biosynthesis of the thyroid hormone. The first, this is the steps of thyroid hormone synthesis. First steps is iodide trapping, second steps is oxidation of iodide ion, third steps is organification of the thyroglobulin and fourth step is oxidative coupling. Now I discuss these steps of the thyroid hormone synthesis. This figure shows the synthesis of thyroid hormone. This is follicular cell. This is follicular cell. And this event occurred within the ECF. This is ECF. This portion is ECF. And cell and ECF. This is basolateral membrane. And this side, this is follicular cell and this is colloid. Mainly this event is occur within the colloid and between the cell and colloid there is presence of apical membrane. This is apical membrane. This is apical membrane. So this is cell, this is basolateral membrane, this is it is ECF and it is colloid and between the cell and colloid there is presence of apical membrane. Now I discuss the every steps of thyroid hormone synthesis. First steps is iodide trapping. Iodide trapping means the process of concentrating iodide within the cell is called iodide trapping. Mainly iodide move from the ECF into the cell by sodium iodide symporter. NIS means sodium iodide symporter, and this sodium iodide symporter also causes co-transport of 2 sodium along with the iodide, and sodium iodide, this is sodium iodide co-transport and this is the secondary active transport. So energy is required. This energy is arised from the sodium potassium pump and this sodium potassium pump is present in the basolateral membrane of the follicular cell, and this process of concentrating iodide within the cell is called iodide trapping. After entering of iodide within the cell, this iodide move from the cell into the colloid across the apical membrane by pendrin. Pendrin is also a carrier protein and another name of the pendrin is chloride iodide counter transporter. So this is overall first steps of the iodide trapping. Then second stage of the biosynthesis of thyroid hormone is oxidation of iodide ion. Oxidation of iodide ion. In the ECF there is presence of iodide, but in the colloid there is it convert into the oxidized iodine. So, iodide is converted into the oxidation of iodide occur and converted into the oxidized iodine, and this reaction mainly promoted by peroxidase enzyme associated with hydrogen peroxide. This peroxidase enzyme mainly present in the apical membrane of the cell. If person hereditary absence of peroxidase enzyme, so oxidation of iodide is not possible, so synthesis of thyroid hormone is goes to the level 0. So, presence of peroxidase is synthesis of thyroid hormone synthesis is important. This is the overall oxidation of iodide ion. Then number 3 is organification of thyroglobulin. Organification of thyroglobulin means this oxidized iodine is bind with the tyrosine residue of the thyroglobulin. This binding of iodide with tyrosine residue of thyroglobulin is called organification. By this organification, that is iodine bind with the tyrosine residue of the thyroglobulin, ultimately formation of MIT and DIT. MIT means monoiodotyrosine and DIT means diiodotyrosine. When one oxidized iodine is combined with the tyrosine residue of the thyroglobulin molecule, there is formation of monoiodotyrosine. When two iodide bind with the tyrosine residue of the thyroglobulin molecule, there is formation of DIT. By this process organification of the thyroglobulin, there is formation of monoiodotyrosine and diiodotyrosine. Then number 4 step is oxidative coupling. Oxidative coupling means when these MIT and DIT mainly coupling with each other. In oxidative coupling stage, when MIT coupling with DIT, there is formation of T3, that is triiodothyronine. When DIT coupling with DIT, there is formation of T4, that is thyroxine. When DIT coupling with MIT, there is formation of reverse T3, and ultimately oxidative coupling, there is formation of this thyroid hormone T3, T4 and reverse T3. This is thyroglobulin molecule. When iodine bind with this tyrosine residue of thyroglobulin by organification and oxidative coupling, there is formation of first MIT DIT, then by coupling T3, T4 and reverse T3, and this is overall steps of the biosynthesis of thyroid hormone. Next, this thyroid hormone synthesis occur, but it is occur within the colloid of the follicle of the thyroid gland. After now I tell how thyroid hormone they are secreted from the cell into the blood. That is how thyroid hormone is come into the blood. Now I told the mechanism of thyroid hormone released from the follicular cell into the blood. This is the apical membrane. This apical membrane protrude pseudopod into the colloid, and they around the some amount of colloid, and ultimately form colloid, and colloid contain the thyroglobulin molecule, and ultimately there is formation of pinocytic vesicle. This pinocytic vesicle ultimately enter into the thyroid follicular cell, and there is lysosome present within the thyroid cell, and this lysosome fuse with this pinocytic vesicle. Ultimately there is formation of digestive vesicle. This digestive vesicle contain many digestive enzyme. One of the enzyme is protease enzyme. This protease enzyme digest the thyroglobulin, ultimately release the MIT, DIT, reverse T3 and T4. This reverse T3 and T4 ultimately release from the cell into the ECF. But MIT and DIT, that is monoiodotyrosine and diiodotyrosine, are remain within the cell, and within the cell there is a presence of deiodinase enzyme. So, deiodination of the MIT and DIT occur, and by deiodinase enzyme MIT and DIT is divided, and the DIT is break down and release iodide and tyrosine. These iodide are further recirculate for the synthesis of the thyroid hormone, and tyrosine is also reutilized because tyrosine is used for synthesis of this thyroglobulin. Previously I told this thyroglobulin is made up of 17 tyrosine amino acid. This is overall today my lecture. Thank you.